Hello. Give it just a couple minutes and we'll go ahead and get started. Okay, we're at about 100, so just in the interest of time, I apologize that I'm coming to you a day late, but we are just very, very swamped at the health department right now with cases and investigations. So just to start out with status, this is what you'll see at 4 p.m. We will be at 1,513 cases at 4 o'clock. So that'll be 59 since our update on Wednesday. Now that we're doing Monday, Wednesday, Friday updates, that has really allowed us some extra time to continue to devote to investigations and contact tracing, which are really the priority of our response at this time. 41 of those 59 in the last 2 days have been community cases. So then a handful of those are DOC and long-term care. The graph that we posted Wednesday at the very end is a graph that shows the difference in growth between community cases, DOC cases, and long-term care. And I think that's an important graph to see. We've shared that a couple of times just to see where we're at in growth in those three realms. Because again, I think, we had this kind of initial large spike back in June with DOC cases, and I think the desire is sometimes to want to feel like they're all in DOC, but they're just not anymore. We do have a significant amount of community cases. The majority of our cases are coming from community spread. So that's important to know. We do have 6 deaths total. We did get a confirmation on a death today, and so we'll be reporting out another death. And then we have 6 that are pending. And when I say pending, I mean that we have been notified that a person who is COVID positive has died, and it is believed that it is COVID related. And we have to wait on a death certificate to be able to certify that and count that as a death. And so we're waiting on 6 of those. I will say a couple of good things that, our weekly count was actually down this week from last week. So on our website, you can see that we calculate cases by week. It's one of the graphs that are on the statistics page. And so I think the prior week we had reported out 305 cases. So that would have been the week of August 23rd. And then this past week we reported 200 and something cases. So it was down from the prior week. And so that's good news. I think that's good to highlight. We still got to keep on with our mitigation efforts, but I think that's a good thing. Another thing to point out is that I'm going to post this graph after I get off of the live, but we're also posting the chart that shows you the percent positive rate since the beginning of the pandemic when we started tracking these. Negatives are not to be reported to the health center locally. They are reported to the Missouri Department of Health, and then they report those to us. And so there's always a week lag in data for that. But what I wanted to point out in that is that last week, we did some calculations this morning and added some negatives. So last week, it brought the percent positivity rate to 16.8%. And then, and again, remember, this is a week behind. And then this past week that we're reporting on, the latest week is down to 12.4%. These are still very significant numbers. For the White House indicator, anything above 10% positivity rate is a red indicator. But I think it's important to point out that that has decreased in the past week. Still seeing a lot of community cases, like I said, per day, and that level is in a red as well. But again, we've seen a decrease in weekly cases, so important thing to point out. Testing. So there's going to be a testing event. I just got a text message. A testing event at Farmington Firehouse on September 21st from 7 to 3. That is being provided by the Missouri Department of Health and the Missouri National Guard. So our Our role in this is mainly just to help promote it and help to set it up. And so, you know, we're really excited for that to happen again, because we weren't sure if we were going to get that after the MAC event. And this is a free event. So you can register at health.mo.gov/community test. And it is on there as Farmington Firehouse. I think they have a misspelling on Farmington right now, so hopefully they'll get that fixed soon. But that's going to be a good opportunity for the community. The other thing I wanted to mention is that, of course, you know, that the Board of Health met a couple weeks ago to discuss a potential mask policy. They, you know, read the policy, did some reviews, have done some edits to that, and are planning to vote on that policy on Tuesday, September 15th at the Centene Center at 4 p.m. Usually we have board meetings here at the Health Center. However, because of the increase in attendance and folks wanting to come to the meeting, we need to have it at a bigger venue to allow for attendees to come. And so we are moving it to the Centene Center for this meeting. Again, that is September the 15th. At 4 p.m. at the Centene Center. Public comment will be allowed, but we will have to have people sign up at the door. It will be 2 minutes limit for each speaker for a max of 30 minutes. And we've taken public comment on this prior. So they are going to have that follow-up meeting on Tuesday. The agenda is on our website right now. If you hit the COVID tab, it's the first thing that comes up. So the agenda and the draft policy is on the website for people to review now. We've also sent our normal notification that we do to the media when we do board meetings, and then I'll be talking about it on the 4 p.m. meeting or 4 p.m. media call today. So those are the big things that I wanted to talk to you about. As far as lives go, the viewing has really dropped off significantly. Time is of the essence for us, and having capacity to do good contact tracing and investigation, and we really need time. So my plan is that September will probably be the last month that we do lives. I will do another one in 2 weeks. But you know, this will probably be the end of the live. A lot of it is becoming very repetitive, and I want to make sure that it's a good use of my time and the community's time. And like I said, the viewing has really dropped off. And then we also are trying to move to weekly updates in October as well, as far as data. The data is very, obviously it's helpful. It's a good tool for the community to know where we're at. And I think, again, it really should be used as a call to action to decide how to move forward. I'd like to be able to provide a little more of an extensive report weekly, but again, that's something that we're working on, and we'll continue to do Monday, Wednesday, Friday for now. So let me go ahead and go back through comments. I don't think there's just a ton. Just kind of a comment about DOC. They do surveillance testing, and so they have a routine for that, for DOC testing. Your phone lines are busy. Yes, they are. Actually, I'm glad I meant to mention that. The phone lines are very busy. There are hundreds of calls happening every day. And so they are very much being tested. So please be patient with us. If you call and you're able to get through, we need you to leave a message, and we will get back to you as soon as we can. You can also submit inquiries via the website. If you go to the Contact Us tab, you can send inquiries via that. Again, you know, we are very behind because of the immense amount of cases that have been reported. So we're about 5 days behind on contact tracing and investigation. So there's things that you can do in the meantime. If you're positive, you need to isolate, so you don't have to wait until we call. If you've been told by your physician that you're positive, go ahead and isolate. Start making a list of your contacts. We go back 48 hours prior to symptom onset, so people who were in close contact with you. Call your contacts. Let them know that they've potentially been exposed, and then they need to quarantine. Again, I know it's not ideal. We're working to get caught up. And, a lot of counties are in the same boat that we are, just with the steep increases in cases. We're working to hire more staff. I'm going to have to rent a building to house those staff. And so those things do take time. How many of these cases are currently hospitalized? So in the last week, we've had 15 hospitalizations. So I think that's important to know. So there's been 80 since the beginning of the pandemic, and in the last week, there's been 15. So. When will all stores have a mandatory mask at the store? Some stores are not required. So I kind of already spoke about, it's the Board of Health and County Commission have the authority to make such an order. And so the board will be voting on that on Tuesday, and that will be their decision. As far as individual stores and their individual policies, that's really up to the store. Somebody asked about how many are active. I did not mention the active number. I think I know what it is, but I don't want to just blurt it out. 665 active cases is what will be reported out today. If someone is positive, do you count everyone in the household? Thank you for asking that. We've gotten that question a lot lately via the message box on Facebook. So the answer is no. There's a couple of ways that happens. So, for example, if I'm positive, my family who is asymptomatic is not going to automatically be counted. They'll be quarantined, but they're not counted as cases unless they go and get tested and they're positive. So that's an obvious one that they would be counted. Or sometimes we will do what's called EpiLink. I think I've talked about this before, but what EpiLink means is that I'm positive. One of my close contacts is symptomatic with symptoms that are consistent with COVID-19 in the incubation period. We always refer our contacts who are symptomatic for testing because we like to have that confirmation, but sometimes they can't or they won't. That means that we might count them. I was pulling up the list so I can give you a number here. So that means that we would count them as epi-linked because, again, they're connected with a positive. They have symptoms that are consistent with COVID-19 and they're in that incubation period. So far, out of 1,513 cases, 22 cases have been epi-linked. Sometimes that number changes a little bit if someone does go and get tested and we move them to PCR testing, usually is what it is. But no, not everybody's going to get counted in the household unless they meet those criteria. And that is Missouri Department of Health's criteria. And that's the same for other diseases such as salmonella. If somebody in the house has salmonella and everybody's got diarrhea and the symptoms of salmonella, we're going to count them as cases. So hope that helps. How come when this virus first arrived, everything was shutting down, but now the cases are rising, but we're not doing a shutdown again? So again, a really good question. There's a couple of things to think about here. So back in March, April, when shutdowns were happening across the country, there were a lot of different things happening. Italy was having a really tough time. New York was having a really tough time. Testing wasn't where it should be. And so, I think everybody was really scared and not enough information was known. But I think in general, we've learned a lot about shutdowns. Shutdowns are a blunt tool and should not be used, every time we see a case increase. We really need to remember what the goal is. And the goal is to slow the spread to prevent the stress to the hospital system. And we've talked about that the hospital system is experiencing, stress. Their resources are being stretched. However, that really is, that really is important to know. We know that shutdowns cause other problems. We have economic stress, people might lose their jobs, and we will cause other issues that are public health issues. And so it's really walking a tightrope to make sure that, we are not closing everything down and causing more problems than what we have with COVID-19, while also trying to slow the spread. And we do have tools in our toolbox that we can use to slow the spread. And that is social distancing, wearing a mask where you can't do that, staying home when you're sick, and using good hygiene. And if we can do that, we can help to slow the spread without causing major economic damage. And I'm speaking kind of globally or maybe beyond St. Francis County at this point. But it's a blunt tool, and it shouldn't just be used anytime we see an increase in cases. So trying to scroll through here. Out of curiosity, how many people test positive for flu or strep throat weekly on average during flu season? Why are cases of COVID reported weekly, but no matter how many children are out of school, during any given week, we pay no attention to the flu? So again, another good question. Strep is not a reportable disease, so we don't have data on strep. Flu is a reportable disease. However, flu is not investigated in the way that COVID-19 is investigated. So flu is done by counting strictly numbers. So we don't ever do investigations on flu unless there are flu deaths. So flu is strictly numbers. On average, it's hard to say as far as week to week, because the peak flu season is from January to March in flu. So you're going to see more cases during that time than what you do at this time of the year. We are embarking on flu season. Enhanced flu season is October to May. And so we do report those numbers to the state. We have reported those numbers out in the past. I think, we haven't had near the audience as what we have right now. And so it seems like maybe that stuff hasn't been reported, but it has. Usually on radio shows or here and there in the Daily Journal, it's not being reported in the way that COVID is, just given the nature of COVID and the pandemic impact. But I think that's important to point out. A bad flu season, we might get 2,000 cases around about. And I think the most deaths that we've had in a season has been 4 since I've been here, and for extended periods. So, those are just some things to know. Will the final vote be public for those who can't attend? So, the meeting is going to be held there in person at the Centene Center, so the public can attend. We are not going to live stream it. It's very complicated to live stream it for us. We had difficulties last time with the sound. We don't have an IT person, and so, at this point, if you're able to attend, it will be that day, September 15th, at the Centene Center at 4 p.m. Checking my time here. So, you will be able to attend that way. And then, of course, we'll have meeting minutes, and there will be a press release. Either way, we will put that information out to the public. Trying to... mostly comments. I'm just trying to read. I see a question about stimulus checks. The health center is not involved in any of that, so I can't answer that. Good question. If you are in healthcare and are around COVID-19 patients, so I assume that means that you were exposed, do you have to quarantine? So that depends on proper PPE. This is by CDC guidance. It depends on what the nature was for the exposure. Now, of course, critical infrastructure workers, which healthcare would fit into that, if they are exposed to COVID-19, they can continue to work so long as they are asymptomatic, but we would ask them not to go into the community. So again, strictly to work, they have to wear a mask at all times, work to social distance, those type of things. But that's how that works for healthcare. So, and the majority of them are, in the healthcare setting in the hospital, they're wearing N95s, full PPE. So, are you going to get some money to help contact trace? Yes. So the county commission has awarded us our application for CARES Act. It has not been given yet. They are still working on the method to get us the money, but it has been awarded, and I've signed the acceptance letter. So, if there are no cases in a nursing home, why can't they at least let one family member in to see how our loved ones are doing? So some of this is CMS regulated. Again, the health center does not actually regulate long-term care facilities. It is regulated by CMS and the state. And so some of that has to do with our positivity rate. I was on a call yesterday with the Division of Long-Term Care and other health departments. And so, that has to do with what the community transmission looks like, because obviously our folks in nursing homes are at high risk for adverse events and severe illness. So, but again, those are things that are CMS regulated. I think I'm out of time. Thank you for being on. Again, testing event, September 21st, 7 to 3, Farmington Firehouse. You can register online at health.mo.gov/community test. It is free. It is a PCR nasal swab. And then again, our board meeting, it's a special session. It's going to be Tuesday, September 15th at 4 p.m. at the Centene Center. Our agenda and also the draft policy is up on our website. Thank you for being on. I will be on in 2 weeks. And, again, we'll continually reassess, what is the most valuable and the best use of time. Please continue doing what you're doing. Stay home when you're sick. Please wear a mask in public places. And of course, work to social distance. I think above all of that stuff, I would say exercise compassion, whether for or against masks, and respect towards others. I think we can all have conversations that are respectful and kind while still expressing our opinions. And, I think that's okay. So we appreciate it. Thank you.